So what we offer is by far the best value that you're ever going to get for a healthcare investment. And it is a huge challenge. And we do have a network of physicians, mobile phlebotomists, imaging centers, lab partners that help us put all this stuff together. We're sort of like 6 or 8 businesses within one, which is very hard to manage. That's probably a reason why no one's been crazy enough to do this, because it's like literally just mobile phlebotomy. That's its own business. To execute on that efficiently throughout the country, that's its own thing. And having it integrated within your app, that's another thing. And we're doing that across all the different platforms, all the different vendors. And it is definitely a challenge, and one that we are constantly working on and evolving.
Welcome back to The In Factor, where we explore the mindset and stories behind entrepreneurial success. I'm Dr. Rebecca White, and today we're diving into an often overlooked but absolutely critical factor in the entrepreneurial journey, and that's our health. Entrepreneurs are known for grit, hustle, and long hours. But what happens when all that drive comes at the cost of our well-being? You know the drill. You've got a project that's due. You've got to get something done before tomorrow. So you work into the late hours, or you get up really early. You give up sleep. You skip working out, all of that so that you can meet the goals and the demands of your business. And I totally get it. That's something that I think we all do from time to time. But research has shown us that entrepreneurs often experience these higher stress levels. They work longer hours, and it often leads to sleep deprivation, burnout, and chronic illness. Maybe you're suffering from some of that yourself because you haven't been taking care of yourself. But here's the reality. There have been studies that have also found that entrepreneurs who prioritize their health report significantly higher levels of productivity and business longevity. Yeah, that's right. Your business is more sustainable if you take care of yourself. And that's why I'm so excited to speak with Xavier Serrano, who's a 2-time healthcare founder and the visionary behind Marqi Medical. After over 20 years in the insurance world, Xavier experienced a personal crisis that reshaped his mission to help others avoid the kind of life-threatening health surprise that almost took his father's life. In this conversation, we talk about not only Xavier's journey as an entrepreneur, but we talk about the importance of the kind of work he's doing for every entrepreneurial leader out there. Today, Marqi Medical is revolutionizing preventive healthcare through AI, diagnostics, and coaching. In fact, he and his team are bringing personalized, proactive healthcare to scale. It's an amazing entrepreneurial feat, and it also serves such an important purpose, not just for us, but for everyone in the world. Building these databases of healthcare experiences and information are so powerful. So it's so exciting to see this overlap of medicine and healthcare and preventive healthcare and entrepreneurship. And I love this story for so many reasons. And that's why I want to share it today. But before we dive into Xavier's story, I want to speak directly to you, the entrepreneurs and the business builders who are listening. Studies have shown that even 20 to 30 minutes of exercise a day can lead you to be more productive and can also help you make sharper decisions. And as an entrepreneur, you're making decisions every day. Another report from the Kauffman Foundation showed that healthy entrepreneurs are more innovative and more likely to scale their ventures. So let today's message from Xavier and this conversation be a gentle reminder to you that your business can't thrive if your body and mind are breaking down. And just as you wouldn't run a business without insurance, you shouldn't navigate your personal health journey without support and protection. So it's out there. Xavier is one example, but there are many more out there. And I want you to make it a priority to ensure that you're taking care of yourself. So let's now dive into this conversation with Xavier Serrano. Xavier, thank you for joining me today on the In Factor.
It's an absolute pleasure and an honor to be here with you, Dr. White.
Well, I'm very excited to talk to you because as we were talking about it before we started recording, healthcare is so important for all of us. And as entrepreneurs, I think we sometimes don't think about that, especially early prevention. And I know you're doing some very innovative things. You're a serial entrepreneur and you have a really cool background story. So I'm really excited. You're the founder of Marqi Medical, and that's your business today that you're working on. But I'd love to start by maybe having you tell the audience a little about Marquis Medical, what you do, what's special about it, and then maybe we'll dive back into your background and sort of how you got here.
All right. Well, that sounds good. Well, it's great to be here and it's great to be in front of your audience. It's a real honor, especially people leading the healthcare initiatives like you are. So really, really glad we were able to connect. So what we do at Marquis is we do something that I believe no one has done in healthcare, which is really offer a personalized predictive health intelligence platform that is holistic and can be offered anywhere in the country. So most scalable solution in the marketplace. And the reason why we started this program is because of a need. And my father, someone who exercised regularly, saw his doctor regularly, was doing all the right things, eating and exercising. If you look at a picture of him, he looks like someone you'd be like, hey, we want you to be more like this gentleman here. He still had good muscle mass, but he nearly died of a widowmaker heart attack back in
Wow.
2020. And that was a wake up point for me because I've been in healthcare for the past 20 years. And I know what people look like, where they need to be healthy and where they not. And I just saw this as like, we need to get people the most data as early as possible to prevent these things. And you probably already know, but for some of the audience members, it's as simple as knowing what the right things to do and look for to prevent these things. A calcium score would have found the fact that he had his arteries nearly 100% blocked, but it wasn't done. They just looked at his cholesterol and they said, yeah, you're fine. Everything's good. And meanwhile, from that last checkup to when he had a heart attack, he was weeks away from having a heart attack. He only had about a 12% chance of surviving it. And we're so lucky that we had it, but it was a wake up call to do something different. I knew what the prevention protocols needed to look like. And that's why I started my company, is to make this information, data, technology available to the masses.
Wow. I love this. I hear about a lot of these things. I love podcasts, obviously, but I listen to a lot of health related podcasts. And there's a lot of controversy in the healthcare system, right? About what kind of tests you need and when you need testing and how to, how to prevent, these kinds of things. I hope your dad's okay now, and I'm glad that he made it through that, but that must have been a real shock, and I love what you're doing. Now, when you say that it's holistic and it uses technology, and give us a few examples. Is this like, a blood test that you would have, or do I sign up and get a lot of tests every year? I mean, how does it work to actually help me ensure that I'm, looking at all the right markers, so to speak?
Yeah, that's a great question. I'm glad you asked it. So, essentially we have uh, you know, 6 parts to our program. So it starts with an intake, getting all your family health history, all of your medical records. So we have a good established baseline of your health. Then we go into deep diagnostics, everything from advanced labs to wearable technology, digital scales, full body MRI, CT scans, some specialized scans depending on the individual. Finally, we're looking at your whole genome. So we look at all 2.8 billion base pairs of your DNA to find out what the predispositions are for your health. And a good analogy for what we do is You would never ignore a leaky pipe in your house, but we all do it, right? We're like, my back's a little bit hurt, or, I have a little bit of brain fog, or I'm a little bit more fatigued than I used to be 10 years ago. And we just all ignore it. And sometimes those things, especially for a lot of high achieving individuals, they just go, I'm just going to muscle through. And then it turns into a big thing. And healthcare is designed to come in at the very end, be like, hey, your house is flooded. Let's go ahead and take care of that pipe. Meanwhile, we could have taken care of it when it was a little bit of a leak or there's a little bit of a crack and gotten there a lot earlier. So that's sort of our diagnostics. When I say holistic, I mean as in depth as it gets, but it's also personalized too. So it's asking the right questions on the front end to make sure that we're putting in the testing that is appropriate, doesn't do harm to the individual. We're not going to put you through unnecessary radiation if that's not necessary. And then we put all that information into MedIQ, which is our proprietary health intelligence engine that's going to analyze these 43,000 data points and come up with a report, which we call Blueprint. And that will give you an exact, blueprint
Yeah,
for
good
your
word.
health. Yeah, it's hard to describe without using it. And it's going to tell you exactly what you need to do to avoid some of these concerns that could be damaging to your health down the road. That information is, of course, conveyed with your physician and executed in part with your individual coach. So that's the Marqi method, the 6-part journey, and we can get it all done within 30 days.
Wow. Wow. So I have so many questions. This is great. I have a lot of questions about how it works, but also I have a ton of questions about how you built this because your background, you came from the insurance space.
That's
So
correct.
not from a medical, not from a medical background,
That's right.
correct? One of the big challenges that I think a lot of people face is once they do identify something, getting in to see a doctor, first of all. I mean, even if you know you've got a leaky pipe, for example, it might take you 6 months to get in, and then getting your insurance to consider all the tests that might be required. So I assume when you came into this, you probably knew a lot of those problems or had seen it. So are you also sort of thinking about how people cover the cost of their health care? And, I know preventive care is always less expensive than fixing something later. In fact,
Right. Yeah.
yeah,
Fixing that pipe is going to cost you a few $100 versus you've got a
yeah.
flood in your house. It's going to cost, potentially, tens of thousands of dollars.
Yeah, yeah. There's a lot of questions, and we can kind of get
Yeah.
back into how you use that. But tell us a little about your background and sort of. I
Yeah.
know that the experience with your father really motivated this and gave you a passion for what you're doing, which I think is incredibly important for entrepreneurs because it's a lot of work, and so you've got to be motivated. But how did your background, how did you get there, and how did it prepare you for what you're doing?
Yeah, that's a really great question. I knew you were going to be bringing in some heat, and that's why I love talking to physicians and to be honest, I think that physicians are actually our biggest advocates and are most excited about what we're doing because physicians want to practice medicine in a way that is preventative and takes care of the individual. But there's so much red tape with insurance and billing and all this different stuff that it actually keeps them from being able to do this. So I sort of have the perfect background to be able to understand both on the medical side and on the insurance side and how to unravel all of this and expedite these processes so that people get the care that they need. So to answer your question, so working within the insurance industry, I actually work with insurance actuaries and working on chronic disease prevention programs for large insurers and large payers of the healthcare system. So I would come in and analyze group health plans and figure out, hey, what are the root causes? How can we put in wellness programs or intervention programs to drive down the cost of healthcare? And I always came into like, hey, this is too little, too late. By the time someone's, type 3 diabetes or stage 4 cancer, like we're just putting band-aids on the problems where we can early detect these things with genetics and other means, and we're just not doing it. So I got very frustrated. So the last 5 years that I did it, I was just kind of, uh, it just in a dark place, feeling almost the guilt of being part of this system that didn't actually help people get better. And yet I was being paid very well to be part of this, small cog in a big wheel. And eventually I just kind of said, you know what? I don't care if I have to give this up. I'm going to go pursue my passion, which is really trying to get to the root cause. So that's a little bit about my background in insurance. To answer your question, yes, we can say, Dr. White, we've got this incredible program, and this is what we found as the root cause, and this is the specialist that we need to refer you to. There's a lot of red tape that we still need to get through. We're sort of experts in that because of my background. The people I work with have been doing this for over 2 decades. So we know what the right protocols are that insurance companies need to see in order to get things approved and expedited. So we do help throughout the process and the member journey outside of what we're currently doing. That is part of our program. When we talk about our program, we had to go outside of insurance because insurance isn't going to go, sure, let's do a genetic test, even though we don't know what we're looking for. But let's go ahead and do this preventative scan, even though you only have a 1% or a 5% chance of finding something. Well, if it's 5%, that's high enough. That's high enough for me. And that's high
Sure.
enough for the general population. They just don't know that these things exist. So we do them as so my first company, as a company sponsored benefit. So think of it like an HSA or an FSA for your company. So we built this program to be able to offer this to anyone in any company as long as your company is willing to sponsor it. And we can package this as a employee benefit. So the employee receives it tax free. The company writes it off. So that was the first problem that I had to solve. And then the second problem was, how do we scale this so it's not just Mayo or just Cleveland or just little locations throughout the country, but anywhere in the country? And that's where we brought in Marqi with our mobile app, our network of 3,500 physicians, our mobile phlebotomy, and all of our imaging center partners, so that now we can truly offer this across the country. So when I say holistic and most scalable, that's what I'm talking about. I'm talking about very in-depth and also very broad, where we can offer this to anyone.
That's amazing. So how many years have you been doing this, from start to finish? How long has it taken you to get to where you are now? Because you've got quite a network built.
Five long years.
Yeah. So you started this right after your father was diagnosed and dealt with, and that was
Yeah.
a really rough time, right? We were all in COVID lockdown, I guess, at that
Yeah.
time.
A lot of companies got started in 2020 because
Sure.
we had to look at things differently. So in a way, it offered a little bit of opportunity to kind of step back and be able to see things, very big picture, and saying, what am I doing here? I was able to have a little bit of time off while, you know, we're trying to get our country, really the world is trying to kind of get its bearings going. So that little bit of clarity that I had allowed me to think bigger picture. And then obviously what happened with my father just made everything a lot easier for me to go, okay, what do I need to do? If I sold my practice, how long do I have until I run out of money? And can I actually make this happen? And we did some of the numbers, made some sacrifices with my family. And luckily, we've been one of the very fortunate, as you know, entrepreneurs typically have a short shelf life and a low success probability. So we were able to have enough people believe in what we're doing that we're able to scale the business to where it is right now.
Yeah, you brought up family, and I know in some of the earlier material I read, you have 3 little children. Is that right?
I do. Yeah. Yes.
So building a company and, it's a great role model for them, but it's also, I'm sure, challenging to juggle all this. So you've built this. Talk to us about how this all came together. It sounds like it's been a lot of bringing together a lot of different partners. Would that be a way to describe it, as well as building the technology?
Yeah, it's it's always evolving, and I often get the question of like, well, eventually Kaiser or someone who has unlimited funds is going to catch up to you guys, right? Like your health intelligence is right now world leading because of how comprehensive and the way that we built it within our back servers and customized data sets. And that is true. So we have to constantly be evolving and getting better, working on the integrations between all the different platforms. And that's been probably one of the biggest challenges is just making sure that we have the right partnerships in place to be able to facilitate and get people through this process I mentioned within 30 days is no easy task. As if you were to try to piece this together, I was talking to another insurance expert yesterday. He's like, I don't even know where it would start, but it would probably take me at least 2 years to put this thing together. So what we offer is by far the best value that you're ever going to get for a healthcare investment. And it is a huge challenge. And we do have a network of physicians, mobile phlebotomists, imaging centers, lab partners that help us put all this stuff together. We're sort of like 6 or 8 businesses within one, which is very hard to manage. That's probably a reason why no one's been crazy enough to do this, because it's like literally just mobile phlebotomy. That's its own business to execute on that efficiently throughout the country. That's its own thing. And having it integrated within your app, that's another thing. And we're doing that across all the different platforms, all the different vendors. And it is definitely a challenge and one that we are constantly working on and evolving.
Yeah. So there are so many new tests and new diagnostics. One that comes to mind for me is the Grail, which is something my husband and I have done for the last few years, and it's pretty impressive, as you know. I'm sure that testing you for cancers, and I know there are so many
54.
diagnostics now, and it's sometimes overwhelming, I think, for the average consumer of medicine who wants that, but maybe they don't have a doctor that's putting it all together, or they're not on a platform like yours.
Right.
And I think that's one of the powerful things that you seem to offer is that you've gone out and you've kind of collected all that. And so your primary market is selling to businesses but also to hospital systems like Mayo or Cleveland, or what is your market? Like, who do you sell to?
So we are predominantly focused on business leaders and key executives of companies.
Okay.
Yeah, so we are working currently with Vistage. So they're the
Yes.
largest
Yeah.
executive mastermind group in the country, and we have been chosen as their premier partner in the health intelligence and longevity space. So that's predominantly, I mean, that keeps us pretty busy. We could go to other masterminds. We could go to other channels. There's endless possibilities. We get asked to work with different countries and healthcare systems, but we're pretty busy. I mean, we definitely do direct to consumer. So anyone can go on a website and say, yes, I want to go ahead and do this program, which we have a few folks that do that. But within the executives and the large companies that we work with, we're pretty busy. We're still working on constantly hiring more physicians, more individuals to kind of help with the back end and expanding our technology solution. But we're very blessed in the market that we chose to work with has been working for us.
Yeah, that makes a whole lot of sense. So I'm an executive, let's say, of a company. And is this a product I might buy just for myself, or that I might buy it for my company? So do you offer various packages for people to buy it? It reminds me a lot of a very advanced executive health program, like they have those at Mayo in Cleveland and many other places where you can go get all your testing. I mean, it's the same sort of philosophy, only much deeper. And is this a one time thing, or is this something that I would do over multiple years? I mean, how does this work?
Yeah, it's a great question. So yeah, you can think of it as a executive physical on steroids, and that's one aspect of it. But the problem that I saw within the early years of doing these programs and working with Mayo and Cleveland. So I set up the insurance programs so that people can get those services. And that's how I started working with companies like that. But the problem with those is kind of like working out one time a year, right? It's great. You feel good. You get the stuff. Maybe they give you, a version of blueprint that you can follow on your own. But most of us just don't have the deep insight to continue to work on that, right? We get busy, we have priorities, and unfortunately, the oxygen mask doesn't go on us. It goes on everyone else before it gets to us. And then you go, if you're lucky enough, you go back the next year and you go, here we are again. How did I do from last year to this year? And be like, well, you just worked out one time. So you're probably the same or worse. So the idea is it's a 12-month program. It's a membership that lasts 12 months. You have ongoing testing. You have ongoing monitoring. We monitor your sleep, your heart rate variability, your ECG, your brain waves, and a neurocognitive function. And then we test throughout the year, depending on the program. All of our programs are 12 months, but obviously the higher end that you have, the more touch points, the more services that you have access to. So you'll have a coach that's going to help you through a 12-month program. And you have your dedicated concierge physician that will also go through this journey with you.
Is that all remote? Do I do everything remotely? I know you mentioned the phlebotomy and other. So are my doctors, do I meet with them remotely? Am I assigned a coach? And how does that all work?
You're assigned a coach and a physician. Some of our physicians, major metropolitan areas, you can absolutely visit them at their offices. And a lot of people still tend to prefer that,
Yeah.
even though we
Yeah.
let them know, be like, hey, you don't have to do that. But then other busy executives who travel a lot, they're all about the Zoom conference and, hey, tell me what's going on. We'll spend, you know, 30 minutes or an hour, whatever that time is, but at least they don't have that travel time built in.
Yeah.
So they prefer that. But yeah, we have both options available, just depending on the market and distance, proximity from your.
Yeah, my husband and I both are big fans of a lot of what you're talking about. We've had a
Yeah,
concierge doctor for many years, and
perfect.
we've done genetic testing, and we've been a part of the Mayo Executive Health Program for a long time. But I do see, I love what you're doing. I think it's really cool. And one of the things I have questions about kind of is how do you decide when new technologies and new tests are available, which ones to include? Because there's a lot going on out there, and there are a lot of people doing things, and there's a lot of I guess there's some disagreement from time to time about what the results tell us and the value of all that. So how do you do that? Do you have experts that review all of them? I mean, what's I guess, the assurance to the user
Yeah.
about what they're getting?
Right. Yeah. So we have a physician committee that reviews new technology and new testing. So we have a set protocol or system where someone says, hey, I saw this. I want to bring this forth to the committee and see if we can offer this as part of our service offering or as a preferred partner of ours. And then as a team, we decide if that makes sense. As you know, you can never get 5 physicians or 5 people to agree on a pizza. So it definitely is not an easy process because what one person believes is medically science-based technology, uh, another person's going to disagree and say, well, it's not quite there because of X, Y, and Z. So then we have to come up with the different studies and really evaluate those studies and see if they're efficacy and results are sufficient enough for us to offer it. I think that's actually a big value add for what we offer is most people don't have that background scientific understanding of different studies and technologies that are available. And I think that being a resource where they can go, hey, Marquis approves it. We know that they don't do anything in the gray area. We think that this is legitimate technology. So Grail is one of our partners. There is enough technology. But even within Grail, there's still, as you know, there's still some caveats saying, hey, by the way, their false positive rate is very high. It has to be high because you want it to be sensitive. So if you
Yeah.
want sensitivity, there's some drawbacks. If you get a positive, there's a good chance it's a false positive, but here are some of the other things that we're looking at. So anytime we have a physician that says, oh, this test is not legit or that imaging is not suitable, you're making people scared and paranoid. Yes, that is only true, however, on that one test if looked at individually. What we're doing is completely different. We're taking into account family health history, genetics, any predispositions, labs, imaging, wearables, all this technology. So I always describe this as, 1 + 1 + 1 equals 10. It's not one thing on its own telling you have a problem. Hey, we're looking at this. Your blood test said this. Your family health history said this. Your genetics said this. All of this together is painting a really good picture, telling us that this is more than likely this is what this is. And as you know, in medicine, it's more of an art than it is a science. Two people are not going to go about the same problem in the same way. But this is actually why I'm so excited about MedIQ and our health intelligence engine, is that we're taking a lot of that guesswork where one individual, maybe one of the best doctors in the world, 50 years experience, can bring in all of their knowledge base, but that's a fraction of a percent of what the entire world knowledge base of science and medicine is, which is what our health intelligence engine is and where AI.
Yeah.
So we're just in a really great place in medicine where we can leverage things like that, where even 12, 24 months ago, we didn't have this level of technology. It's advancing that fast.
Yeah, it's pretty amazing because with your med IQ, is that what you called it? I'm sure you can feed a lot of information, and the more participants you have, the more experiences you have, the more doctors, the more partners you bring on, the more that can grow and the more we can learn from all that, which is really, it's the frontiers and of
Yeah.
medicine. That's what we're seeing a lot of. I think it's so exciting to see that. We've been saying for a long time that there are lots of longevity opportunities, that we were going to find ways for people to live healthier longer, which I think is what we need to think about with longevity. But the reality is it is not easy to do what you've done. That is, bring all these partners to the table. So you've got all these independent companies, right? Like the wearables and you've got all the doctors, and you had to bring all that together. Was that one of the biggest challenges that you've had in building this, or share with me maybe what have been the challenges with putting this all together that you've learned from?
Yeah. I would say, and it's probably obvious to some people listening, but I would say the compliance and
Yeah.
regulatory hurdles are probably bigger than getting the partners. Also finding the right partners with the right technology, API integrations, putting all of that together definitely has been a challenge. And we're still continuing to evolve our technology. But it's difficult because even though maybe this side of the equation is really strong and advanced, but then if this is only 20% of that and they aren't integrated, you're just not going to get a full 360-degree um, product offering. So it's all been challenging. We're working on it. We continue to work on it and try to evolve every single practically in different ways. But there's been a lot of challenges. I wouldn't say it's one. I would say this is probably like 1,000 different challenges we've had to overcome. Yeah, I joke around, I kid with people, but it's just interesting. 5 years ago when we started working on this, or even 2 years ago when we were working on this, we were just not as far along. People were like, brilliant, you did it. Like it's overnight. And it's like, no, there's been a lot of iterations, a lot of hard work, sweat, tears, little bit of blood along the way.
5-year overnight success, right?
Yeah, yeah, exactly.
AI and the advancement there, just like you said, in the last 12 months, 18 months, it's crazy just the productivity that we're all experiencing and the ability with these models, these large language models and the analytical models and what they can do. It's just phenomenal. And customized medicine, that is has made such advancements. I was working with Moffitt Cancer Center here in Tampa maybe 10 years ago, and I remember all this talk about customized medicine, and now we're truly getting closer and closer in so many ways. As you've built this, it's probably taken a village, if you will, a lot of partners, a lot of people. How about funding it? Because that's always a big challenge in anything in the medical field that and this, it mentioned compliance. I know it can be even worse when you're putting together a pharmaceutical product or something like that. But funding is often always a big challenge. How have you managed that piece of the equation?
Believe it or not, up to this point, we've been 100% bootstrapped for this business. So it's definitely, that's been one of the biggest challenges, but it's also been a blessing for a lot of the obvious reasons for a lot of entrepreneurs, I'm sure. So my first company, we went VC funded and we gave up a significant amount of the control over the organization and we just couldn't quite get our bearings straight. And I think it's probably some of the issues that people say, like, hey, don't spoil your child. They're not going to figure things out on their own. Got to let them fail. So we took the complete opposite approach for this one. We were, as I mentioned, we've been so blessed to find the right partners, the right mentors, and the right leaders who have been just passionate about what we're doing. And we're able to find the right companies that have been excited about bringing forth this level of precision medicine to their members and to their team members. So we've been just so fortunate that we found the right people that have invested into this technology and into our company that we just haven't had a need. We would like to grow faster. We think that the competition is going to go, wow, that's a great idea. We should probably do that. And we've been sort of putting this off for a long time. We're like, "Oh, I don't know if I want to put all of our trade secrets available on the internet for a
Right.
long time." And that's been a little bit of a challenge, but at the same time, people need to find us. So it's kind of a double-edged sword.
Yep. Yep.
So we've been sort of stealth mode, just working with our partners and organizations for the last year. And now we're finally saying, you know what? I think we've got something that it's going to take someone at least a year. And I think that in a year from now, we're going to be so much further along. They're constantly going to try to play catch up with us. So that's kind of where we're at.
Yeah. I love that you're working with Visage. I think that's an incredible market. Have you considered, and maybe you're already doing this, partnering with independent concierge doctors practices with their patients so that you could provide them this kind of, access to all the products that you offer?
We're beta testing that right now. That is definitely an industry vertical and it's part of our grander vision for our company. So we don't want to be, just this service for elite business owners. We want to eventually offer different levels of our service where anyone at any means, if they have $100 a month, if they have $1,000 a month, somewhere in between, they can have access to this incredible technology and preventative care services. And we're working towards that. The concierge model is definitely an industry vertical that we want to pursue. As I mentioned, we're so busy right now with the amount of work that we have. There's a considerable amount of training that goes into, hey, here's a new EHR, here's a new way of doing medicine. So we'd have to just build out. And again, that's probably where if we had a little bit more funding, we'd say, hey, this is your project. Let's go ahead and build out this physician training program that they can enroll in and start offering these services. And that's ultimately how we're going to get to scale is like, how can we get more and more individuals, physicians involved in this so that we can offer this at scale to anyone, anywhere in the country. So we're working on it. It's just, one of those things where we've got massive amounts of opportunity where we just don't have enough resources to kind of
Yeah.
work everyone.
Yeah. Well, it's a great situation to be in. I would say that you're very smart to have bootstrapped to this point because now that you are beginning to see growth opportunities, you have something real and meaningful, and so you're not bringing money in too soon, which is a mistake that a lot of entrepreneurs make
I
because you
already
don't
made it. I already made it. So don't pat me on
well,
the back.
yeah, well, the best way to learn is to make a mistake, right? So I think that's a great story in and of itself. But I think, most of the time we don't know where to spend the money too early. So you may be at that point now. And I think there are, functional medicine is another area, doctors that really understand the mindset that you're talking about. But I think we're headed, I don't want to get into politics, but I know that even today in today's political environment in the US, a lot of people are looking at our healthcare and looking at how we can be more focused on preventive kinds of things and what's happening for us. So, I wanted to ask you what's next for you, but we kind of already got into that. But I don't know if you've got other things to add, like what's your vision, maybe beyond what we've already talked about, and what is the next 5 years look like for Marquis?
Yeah. Yeah, I'm super excited about the next 5 years because I completely agree with you. Where we're at is just not sustainable. We're all very much aware that we are way overpaying for healthcare right now and having significantly worse outcomes than any other developed nation by magnitude of at least a 2x. So everybody knows this and no one can kind of figure it out. I think the really intelligent people in this country understand that we do need some form of a single payer. And I know it's not popular, right? Because we're seeing the issues that other countries have with single payer. But Medicare is a form of single payer. And that still allows a lot of flexibility saying, hey, if you don't want to go with Aetna, you can go with this company, with Cigna. You don't want Cigna, you can go Blue Shield. You know, Blue Shield, you can go Blue Cross. So there's still options within that. So it's not as scary as people think. And again, I have the fortitude of having that background in insurance. So I definitely understand where that's going. So unfortunately, I would love to take on full major medical and saying, hey, Marquis is the healthcare of the future. It's going to have to start with something like a Medicare where it's saying, hey, we're on a single payer system. Everyone 65 and up is in the same pool. And if you ask anyone who's 65, they'll all tell you healthcare got so much better when I turned 65. I was so scared of it. Now they pay for my gyms, my co-pays are low, my co-insurance is low. It's like, what are we all doing here that are scared of single payer? Ask anyone who's 65 and up. In general, they're much happier. It covers a lot more. Why would we not offer that to everyone? I don't know if we're going to get there in the next 5 years. I hope that we can, but there's a lot of people making a lot of money within our current healthcare system where that's going to be a little bit of a challenge. So I think it's probably going to be something along those lines. We still actually have 50%, close to 50% who are government or some sort of single payer or self-funded programs that we can target, that we can actually make a significant difference and change into. So I'm really excited about moving in that direction where, again, we can help more people, but it's going to take a lot of changes within our current healthcare system. But I do believe it's inevitable. We can't be spending right now, we're close to 20% of our GDP in healthcare, which is astronomically high with again, as I mentioned, worst outcomes.
Right, right. You're right. It's got to change. And we got a lot of smart people like you and your company who are looking at it and trying to make a difference. I applaud you for that. And you have to start somewhere. And your dreams of making this, more accessible, I think are phenomenal. And I think you'll get there. So a lot of times opportunities are about timing. This may not have the timing may not have been right 10 years ago, but I think you're there now. And even 5 years ago, when you started this, it was probably a leap of faith. So, but I think that's what every entrepreneur does. It's a hypothesis and we start proving it or disproving it. And it's a scientific experiment, just like everything else. But, this has been great, Xavier. I know we could talk a lot more about it, but I know you've got a business to run. I love the concept. I'm going to check it out. I'm going to go take a look again at what you offer. And I hope that all of our listeners will do the same. I think it's very important, not only, you're demonstrating, that you can build a company around this, but that you're making a difference in the world. If you had one piece of advice for an entrepreneur out there listening that about their health or about starting a business, what would that be?
I'm gonna go with health because I haven't proven out that I'm that successful in business yet. Hopefully, watching this 5 years from now, I'd be like, oh, we knew he was gonna make it, but
Yeah, I got
I
confidence.
always have to prove out every single day that I can make it and try to make it as impactful of a day as possible. But I would say that with all the people that have gone through our program, the single biggest problem that most people have is sleep, this quality of sleep. That's across the board, whether you're a busy executive or you're someone who's younger and maybe starting out in their business career. This tends to be one of the biggest problems that they have. And a lot of people will tell you, oh, well, you just need to get good, get a better night's sleep and track it. And that's actually not the answer. And that's not what we're offering either. We're not just offering, hey, here's a bunch of data, go figure it out. And it starts with a good bedtime routine. It starts with getting off of electronics for at least an hour before. And it's also about consistency, and everything we talk about is consistency. I mentioned the gym thing, right? It's like you just can't get results if you do something well one time. It's just not going to get anywhere. So just building a good routine, getting the quality of sleep, and that affects everything, right? It affects your mental aptitude and capacity. It sets up your entire day the next day. It sets up your whole week, right? Because now you're consistent week to week, day to day. And it's like the smallest thing that most people probably overlook. And some people will listen to this and be like, well, that's like the dumbest thing I've ever heard. I've heard that many a times. But the problem is no one ever tells you exactly what to do to get there. So we have over 100 articles on our website. Sleep is definitely one of them that we've covered several times. So we give a lot of free education and ways for you to empower yourself. So you don't have to be a member. You can go on our website, you can take a free health risk assessment, have our AI actually give you recommendations for what to do on your own. So for the DIYers or people who have zero uh, income to invest into a full program like ours, there's still stuff that you can do. And then, hopefully, down the road or as we scale the business, we can offer more things, we'll be there for those individuals. We want to get them as empowered as possible and make that information accessible and free. So that's kind of what we do. And so whether it's sleep or whether it's hormones or whether it's something else, there's something in one of our 100 articles that could probably help.
That's fantastic. And I love your advice. And I know that busy people sometimes forego sleep to get things done. So it's probably something we need to rethink. And I appreciate that. I appreciate the offer of all the resources that you share on your website. Where can anybody who's listening connect with you, find your website, find out more about what you're doing?
So marqimedical.com. That's a unique spelling, Marqi medical. And they can find me on LinkedIn. So more than happy to chat with anyone who's interested in doing a deeper dive into their health or needs advice on starting up a business or anything else in between.
Thank you, Xavier. This has been great. I really appreciate you joining me today.
Pleasure's all mine. Thank you so much for the opportunity.
I hope you enjoyed this conversation with Xavier Serrano. It was really fun to be talking about the intersection of healthcare, technology, innovation, and entrepreneurship. I hope it also reminded all of us that healthcare isn't just a personal matter, it's a strategic imperative for entrepreneurs. Taking ownership of our well being is one of the smartest investments we can make. As always, thank you for joining me here on the In Factor. And don't forget to share this episode with fellow founders, subscribe, and remember, you are your most important asset. Take care of it.